Hello, I'm Gabby, and one of the reasons why I decided to become a nurse was ever since I was little, I was always super fascinated about the medical field, and I knew I wanted to do something that involved the medical field. As I grew up, I loved to learn about the human body and how it worked and what it was composed of, and I also love to help people. So doing nursing, that allows me to combine both of that to give service to others and also learn about the medical field and learn about the human body. And another reason why I specifically chose nursing was I'm an EMT and I volunteer with a lot of other nurses or doctors, and I just have been kind of surrounded by that environment for a while, and just getting to experience that firsthand has been really amazing and really awesome to see. As a nurse, and frankly anyone, it is important to take care of yourself so that you can be healthy and strong, so that you can help other people become healthy and strong. And by that, you can influence other positive behavior to other people, because if you're healthy and taking care of yourself, that'll influence other people to do the same. Some of the special things that nurses get to do are make deep personal connections with their patients, which are a little different than the relationships that doctors create. I feel like nurses have a lot more personal relationships and connections to the patients because I feel like they're with them more often. Important qualities of nurses are confidence, empathy, kindness, and persistence. So confidence is definitely a big one. I think it's super important to have confidence going into the ER, going into wherever you're going, where you work. You need to know what you're doing, and you need to be sure that what you're doing is right, because you're dealing with patients' lives, and that is super important. I would say nurses are advocates for health and wellness. They definitely play a big role in providing health and wellness to people. They are really responsible for making people healthy and getting them back to where they can be, or getting them back to where they should be in a mental state or in a physical state. So they really are that help, that push that helps people to get healthier and where they should be. Some skills that definitely benefit nurses or are beneficial to nurses that I really relate with are bilingualism, or just speaking any other language, or any two languages or three languages. I feel like that is equivalent to having multiple people, because you're able to communicate with other people about other things, and there isn't really as much of a barrier or as much of an issue when providing medical care. It just makes everything a lot easier, and it makes everything a lot quicker, and you can get help to that patient a lot sooner if you know that language that they're speaking, if they can't speak English. And another one is social intelligence. It's really hard when you don't understand, or you can't tell what a patient is feeling by their facial expressions or by how they're speaking. And so to have that social intelligence is also a good key indicator for what your patients are feeling and how they are doing. And I feel like those two are really big ones that aren't so common that are talked about, but they definitely have a really big impact on how nurses do their job. Lastly, my definition of nursing, I kind of like to think about it as being a mother, because mothers take care of you and they guide you and they support you through the hard times, and when you scrape your knee to where you're having a lot bigger issues. And I feel like nurses are definitely that type of role.